see angioplasty with stringent door-to-balloon times and using even clot-busting medicines. These are very attractive, but they're simply, if you look at it, they're just 1,000 patients a year, maybe 1,500 patients a year of the hundreds of thousands of people we come across. So,
right.
So it really, I think the onus is primarily upon the medical community, but really at the end of the day, the buck shifts to the patient. As an adult, it's all individual responsibility of understanding what are the risk factors that you so laid out. If you have any of those risk factors, if you have strong family history, you have to pay specific attention to the warning signs of these heart attacks and strokes, which are, of course, again, the extreme manifestation of years of unawareness of having vascular risk factors of all the things we just talked about. And then they culminate when they're neglected for year after year after year, either willfully or unwillfully. One fine day, they're going to present as a heart attack or a stroke. And now we are kind of moving on into this other phase out of our discussion. So what are the signs of heart attack that you look for? And I also want to remind our audience that if they have any questions related to this topic or other cardiovascular health issues, the number is at the bottom of their screen. They're welcome to call us anytime during this live call-in show. So please go ahead, Clay, and let us discuss about some of the warning signs.
The warning signs, and where we'll start, I would think, start with the heart. That's generally, listening to your numbers, heart attack patient or heart attack deaths, I believe it was about 6 times higher than the stroke related deaths. So much more frequent, but not always as devastating as a stroke. But we'll start with the sign and symptoms of a, I don't know if we should say heart attack or heart disease, because there are subtle differences. Specifically for a heart attack, everyone needs to know, the fullness, the pressure, heaviness of the chest, a feeling of not being able to breathe well, a feeling of impending doom. Those are the big signs of an ensuing heart attack actually it happening. That's associated along with some vague nausea, basically a cold sweat, a cold clammy feeling, but yet sweating bullets off the forehead, and that sort of thing. Those are the big classic warning signs that you need to get to an emergency room and fast, because obviously something's not right, and it's pretty classic of a heart attack. Now, there are more subtle signs that may be symptoms of heart disease, i.e. coronary artery disease or blockage, which is not yet a heart attack, not necessarily causing damage to the heart, but nonetheless just as important, because you can actually get seen, get treated, and get fixed before any damage from a heart attack actually occurs. And again, the same feeling of pressure or tightness in the chest, usually associated with some type of activity, exertional activity, and that kind of depends upon your level of activity. If you're pretty much a couch potato and don't do much, the mere chore of carrying a heavy bag of groceries back and forth to the car, or sweeping or mopping in the house, changing a bed, lifting a mattress and things like that, just little things like that can cause enough exertion to cause some chest discomfort or shortness of breath. I think that's a majorly overlooked component of vascular disease. We talk about shortness of breath, everybody thinks of the lungs, but shortness of breath is a major sign or symptom of heart disease, or either heart disease of the heart itself or heart vascular disease of the coronary arteries too. So never to be overlooked. In women, and I guess this is what I was referring to earlier, women are kind of a whole different story. I generally tell my patients that if it hurts between the hip bone and the top of the head in a female, it could be the heart, because we're learning this over time that women do not present as equally as men. They've historically been overlooked a lot of times because their symptoms aren't the classic crushing chest pain with sweating with diaphoresis and shortness of breath, and they present a lot more subtly, just ill feelings of mild depression, vague symptoms that they may think is gallbladder or something like that. So in women, it's a much more subtle thing, and the key there is for us, the physicians, just to be acutely aware that it may not be classic.
That's right, and I think historically, as you just mentioned, that women, I guess partly because that was in the beginning, it was even inferred as treatment bias, but I think maybe there was some of that too, but I think women are more stoic and in this culture and other cultures, and men are more crybabies, I guess. And in a society that is tuned to think differently, women were played a different role in the past, and they were not complaining. They bore the brunt of all this without complaining, so ended up that they came in much later and were actually a lot sicker.
Right.
Ended up that they had far worse outcomes in the past. Whereas I think the American Heart Association and all the education, all the multiple societies, the cardiovascular and stroke societies, and all of them have done enormous job. As you just said, like we keep on repeating it. Sometimes we are like, we feel kind of sick almost repeating it, but nonetheless, as each patient walks in, as we encounter them again and again and again and again, you're repeating this stuff, and it's not the classic crushing chest pain. Would be nice, but unfortunately all of us have heard 100 different variations of this vague chest pain, indigestion, I just feel like bad heartburn.
Right.
Oh, I thought it'll pass away, I took Tums and slept. How many times have we not heard this? It's just enormous, but looks like we have our first caller. We'll take this call and get back to our discussion. On line one, Mike from Lafayette.
Hello, Mike, you have a question?
My wife's in her 50s, and we've been told that heart attacks are actually more common in women than men, and that the symptoms are not as pronounced. So what do we look for, to tell if she's actually, if she's having a chest pain or something?
Okay, that is the...
what we were talking about.
That is the subject we were just touching upon. Mike just called in and said that his wife is just about getting into 50s, and his understanding is that the heart disease is actually higher in women. And what is it that they look for is his question. But as women approach in the earlier days, and I think the hormonal protection of the women starts to wear off as women get into this postmenopausal stage, and probably more into 60s and all that. They really go into this so-called catch-up period. They're really catching up with men, as opposed to men don't have the hormones that are protecting the women from heart disease in the earlier. So they are susceptible to heart attacks and heart disease, manifest heart disease like heart attacks at a much earlier stage, like 40s and 50s. But whereas women start off having in a little later stage, into 50s, 60s, and really peaking into 70s, so there is a significant catch-up. And of course, the signs and symptoms of women are again vague. I mean, to the point they can even confuse a heart attack with a heart flash. Mm-hmm. Like there have been instances when we come in there and they're getting menopausal, and they have this kind of flushing, burning sensation in the chest. So really, I mean, any number of things, indigestion, like Dr. Hammett pointed out, any kind of vague, unexplained new discomfort at rest associated with significant shortness of breath, or if you're exerting, you're carrying groceries or something, and you feel a significant tightness in your chest, and that is not ordinary for you. You're used to carrying your grocery bags all through from your driveway all the way, significant amount of load, or doing yard work and carrying whatever bags of mulch or something, and you feel this unusual tightness, unusual fatigue, even if it is not classic. You're just basically winded. You just don't have anything left. Your ability to work is cut off in half, and you have to take longer breaks. All the above. So really nothing is exempt. If you had a certain level of energy before, And if it is suddenly for no clear reason, if that energy level has gone down significantly, and of course, if you have any of the risk factors, and if you really are not taking care of yourself, in the sense that if you're significantly overweight as a woman or a man, and if you have a history of diabetes, and if your diet, you think you can do a whole lot better, we'll get there to that diet part. And also, if you smoke to any level or chew tobacco, or if you have a strong family history of heart disease, including parents or siblings, they have to have a heightened awareness. Not that they have to run for every little bit to the hospital, but surprisingly, they show up later and we do EKGs, and a lot of times we see him, he actually seems like he had a heart attack at home.
Yeah. Yeah.
And they're totally shocked. What do you mean I had a heart attack? They can't even recognize that they might have had a heart attack. So I think it is reasonable to be somewhat paranoid, not too paranoid, but somewhat paranoid as you get into that age. If you have the risk factors, just have a little more heightened awareness, be it a man or a woman. As we are approaching halftime of this show, we'll probably try and take a little break here, and we'll come back in a few minutes. Clay, you wanted to just add?
Address something with Mike when he brought it to my attention, about the women actually having more heart attacks than men, and I think it's probably pretty close to 50-50. It gets twisted in the statistics, and women, like Dr. Farina was talking about, women definitely catch up with men after post-menopause. That their risk and their chance of developing vascular disease skyrockets at a much more higher rate than men do at that age. But also, looking at later in life, women tend to live longer than men. And therefore, the number of elderly women having heart attacks or strokes tends to skew the numbers to make it look like men and women. So don't want to shortchange the men in this one. It's
right.
50-50. And it basically boils down to, if you've got a concern and if you've got some risk factors, check it out.
That's right. Be it a man or woman, I think it's the same pathway, and certainly women have to be equally cautious in our society. And certainly, I think we are doing, the society has done a tremendous job in educating all of them to, do all these right things, eat right, and don't smoke, and don't drink, and so on and so forth. But I think we'll get to continue that discussion. We'll take a tiny break here and come back to our discussion on the science of heart attack and stroke, both in men and women.
I never thought it would happen to me.
I never thought it would happen to me. I didn't know women my age were at risk for heart disease.
Heart attacks are by far the most common cause of death in the United States of America. Many occur with no warning symptoms at all. Cardiovascular Institute of the South is the leader in treating cardiovascular and peripheral vascular disease. If you think you may be at risk of having a heart attack, come see us at any one of our 11 locations. Even the very best heart care is of value only if you have access to it. So here's our pledge. If you have chest pains or symptoms of a heart attack, you'll be seen at any hour, day or night. If you don't have symptoms, but you or your doctor have concerns about your heart, you'll be seen within 48 hours. And even a routine heart check will normally be scheduled within a week. CIS is one of the largest, most advanced facilities in the South with an international reputation for treating heart disease. Call us to schedule your appointment.
Good evening and welcome back to our live call-in show this evening, the signs and symptoms of heart attack and stroke in men and women. I have with me Dr. Hammett, who's an interventional cardiologist at Opelousas General and Cardiovascular Institute of South, and we both have worked together. Dr. Hammett has had multiple more years of experience than I've had in South Louisiana. And I've joined the whole group's efforts here at CIS and OGH for the past 5.5 years. And we have been enormously fortunate in a way to help this community and in turn be exposed to the enormity or the burden of cardiovascular disease and stroke in this area. And we have made tremendous strides in improving our speed in getting to these patients in the acute settings. And of course, for stroke, For heart attacks, we're always available 24/7 to take care of patients, come in and do interventions in patients that are experiencing